Good evening, everybody. Good evening, all the participants here. It's a pleasure to have you all with us. We have here with us Dr. Saher Mehdi, who is the co-founder as well as the Chief Scientific Officer at wellOwise. Saher, would you like to tell us a little more about yourself?
Okay, so I'm just a scientist turned entrepreneur. I did my PhD from Durham, and following that, I had a long kind of several years of postdoctoral work and independent fellowship at Oxford University in Sweden and Belgium, predominantly looking at epigenetic mechanisms regulating stress and aging in human diseases. And 2 years ago, I decided to come back, gave up all my research background, leave my research background behind, and come to India and co-found this company with Manish, which we are presenting today, wellOwise.
That's great. That's great, Saher. So, introducing me, I'm Dr. Ishani. I am a consultant with the wellOwise. And today we are going to talk about, Saher is going to tell us a little more about precision health, an intriguing concept to me as a clinician myself. So let's just dive straight into it, Saher.
Okay, thank you, Ishani. And as she said, wellOwise is a precision health startup. And at wellOwise, we are trying to develop tools, precision health based tools for mainly two purposes. One, for timely prevention, and two, for effective diagnosis of chronic diseases. Our goal is to basically help people live better and longer by predicting and preventing diseases or chronic diseases, so to say, before their onset. And it might sound like a very small task, but believe me, it's a huge task and one that cannot be done alone. And today's talk will predominantly focus on introducing how precision health approach can help clinicians or healthcare practitioners, so to say, in a broader perspective, to make and capture, know the exact cause of these underlying causes of these chronic diseases, how we can help them, give them tools so that they can capture these changes that are leading from health to disease, and how these tools can help them achieve, or healthcare practitioners achieve, better clinical outcomes, and for general masses achieve better health, so to say, in the end. So before I start talking about what precision health is and in general, I just want you all to just pause for a second and think, what is actually wrong in the current approach to health? How do we look at health? So in my opinion, the way we look at health, So in my opinion, the way we look at health today is basically we are looking individuals as average of a population. The treatment options that we are giving them are designed for an average population. They are not designed to be tailored to an individual needs, and doesn't take into account the individual variability in their genes or in their lifestyle. And even when we look at an individual point of view, we often tend to ignore the multidimensionality of the health. So as a clinician or as a healthcare practitioners, we often tend to look at the physical symptoms and focus on the physical symptoms or of the disease, rather than knowing what sort of has caused, what has led to these physical symptoms. So the underlying genetic and lifestyle modification that has led to those physical characteristics. We often tend to ignore this. And that's what the slide says, that the traditional approach ignores the individuality in genes and lifestyle and environment. And leads to say that this way or this approach has been quite inefficient and has led to vicious cycle of chronic diseases.
That is so true, Saher. There is a burden and an epidemic of chronic diseases that is awaiting us even after COVID now. So
Exactly. So this slide is basically to reiterate the point that we often tend to ignore the early symptoms or the early underlying risk factors that lead to chronic diseases. And by the time, often for most health practitioners, people come with symptoms, people come with diseases. People don't come when these and And chronic diseases in general are slow and insidious in their progression, unlike infectious diseases, which show very quick symptoms. Chronic diseases take a long time of accumulation of molecular damages over a long period of time, and then the symptoms appear. And what we are doing, we are trying to, at wellOwise, we are trying to capture these molecular changes in a timely manner, points where they are actionable before the symptoms appear or we see the pre-symptoms of a disease. And so there is the way where we can approach this, and we can make this little better. So leading to that, since we are unable to capture these molecular changes, and this has led to a huge loss in number of people, and there is an opportunity to save lives. But and precision health gives us this unique approach, or a newer way or a bolder way, in which way this problem of chronic diseases can be tackled. I don't know, I'm having some troubles with my with my presentation. I don't know if all of you can see it.
It's good, Saher.
Okay. Yes, so coming to the concept of precision health, I just want to say that the precision health gives us or dissects the granularity of various components that go towards this shift from health to disease. So think of health as health. We often tend to think of health and disease as separate states, and we ignore the molecular changes that happen or in the path from health to disease. And what precision health does is basically looks at this in a more holistic manner, that the little molecular changes that happen at the DNA level, all these lifestyle factors or macro factors, our diet, our lifestyle, our environment, is constantly interacting with the DNA. So to say, are switching off and on our DNA in order to express these phenotypes, the health phenotypes or the disease phenotypes, so to say. And it is this whole essence or the approach to health, the holistic approach to health. If we can capture this, then we can basically diagnose and treat or prevent diseases in a timely manner. So going to following that same slide, this is more of a molecular view of what's going on at the cellular level. These epigenetic changes or the macro changes of the lifestyle, see the developmental changes, whether it's the diet or our aging, are all contributing or physically actually changing the not so to the structure, but actually changing the composition of DNA, so to say. And it is actually switching off and on the DNA, making it more condensed in some cases and more open in other cases, and hence showing off the disease symptom in cases of autoimmune diseases, cancer, mental health diseases. And the contribution, we have to understand this, that the contribution of genes and lifestyle is actually quite variable, and it differs across chronic diseases. For example, diabetes, the contribution for genetics is about 30% or 40%, but for mental health, the contribution from your genes is almost like 70 to 80%. And hence, we have to understand that there is a close dynamics between your lifestyle and your genes constantly. And our lifestyle is constantly affecting our DNA for good or bad.
Saher, is it probably right to assume from the slide that you just showed us, is it right to assume that even though I don't have a family history for a particular chronic disease, say diabetes, my lifestyle can put me at risk to such a disease, can change my genes as well?
Yes. So even without having, so what you are saying that a bad lifestyle actually can influence you, epigenetically not change the structure, but epigenetically influence your DNA, and hence do the changes at molecular level. For example, you see the rise in your sugar levels, or you become hypertensive and stuff. And these are the changes that are happening because certain genes are being switched off and on. So even despite of not having a genetic predisposition, if you have a very bad lifestyle, you are predisposed to these things.
Okay. I would like to request the participants, if you have any questions, please feel free to write it down in the chat. Sorry to interrupt, Saher. Please go on.
Okay. No. So what basically I have kind of trying to say here in this slide is the way we look at health or health at the moment is very fragmented. So there is, our genes at one side, and often we do prenatal screening, or in cancers, we do screening of the DNA to look at the changes. And in chronic diseases, we tend to focus on, diet, lifestyle, and we often think of these two things as very isolated. But now DNA has the power to predict disease, truly predict disease, and capture these molecular changes that you might have had from your family history, or you have accumulated due to the epigenetic changes. And also the other thing, the question mark that is between health and disease, that indicates that if we have right tools to capture the molecular changes that lead from health to disease, we can have a better understanding or better approach to, towards health and understanding disease, so to say. So at wellOwise, as I said, we are using precision health approach and power of digital technologies to put the focus back on individual variabilities, to transform your health for better. So this brings me to summarize what we, in a way, do, all the work that is being done. In essence, we collect multidimensional data in a very immersive manner. We collect multidimensional data right from taking your blood for genetic screening, to your clinical blood markers, to your lifestyle, to your diet, your behavior. We record all these things and put them through our analytical platform, and with two major outcomes, so to say. The major outcome that we are focusing today is the precision diagnosis program that is designed for healthcare practitioners like clinicians, nutritionists, or health coaches. What it does there is basically we can give you those changes or the causalities of the symptoms that will help you know what actions to take. And all this is delivered through our simple clinical and consumer apps that I will illustrate in the following slide. We also run a preventative health program for individuals who are actually not showing any symptoms, but want to be aware and identify the indicators of health. What are the key indicators of health and disease? So within the preventative health program, we can give you a risk assessment of around 200 traits that affect your health across 4 major sections of nutrition, health, fitness, and wellness. And by simple personalized dietary and lifestyle recommendation, we can help you prevent these chronic diseases.
Wow.
Then focusing on the precision health program, or the precision health program for clinicians, it is a very simple program where a clinician can just go online and download the app, or just go download the app. And once the clinician makes the initial diagnosis and feels there is a need to sign up for a precision health program, a clinician can just do it by clicking a simple button and signing up the patient for the precision health program. Once the patient is assigned to us, we do advanced genotyping. And when I say advanced genotyping, I will explain that we, in addition to going to the SNP level changes, we also give clinician information about the underlying gene networks, the drugs that can be given, what quantities of drugs, and all that. We also do a detailed phenotyping, which is often missed in today's clinical practice because either there is lack of tools, but also more so the lack of time, because the burden on clinicians is so much that they really don't have additional time to sit with the patient and take a detailed history of what has been happening with them for last 5 years, what is their lifestyle, what is their diet, what is their occupation, what are the environmental things that they do. And I will illustrate this in my presentation today, that how we can capture these. So all this information goes into our analytical platform, which analyzes and identifies the unique altered changes at molecular level. And then we convert these insights and into a simplified report for clinician to not only confirm the primary diagnosis, but also if there is a differential diagnosis, confirm that. Understand what other related comorbidities or diseases can be associated with this, and give them pharmacogenetics insight as well. Once the primary diagnosis is confirmed, we also give a detailed disease-specific dietary intervention for the patient as well, so that there are better clinical outcomes. Because often, patients say, okay, once I start taking the pills, I don't need to do any dietary restrictions and stuff like that. But in most chronic diseases, we know that how important diet has a huge role to play. So this is then just a snapshot of what our clinical report looks like. So I want to highlight here a few things. The red things that you see in pathogenic. So a clinical report is usually based, most genetic companies will base their clinical outcomes or report, SNP level details on clinically relevant SNP database, which is also known as ClinVar, and on American Council of Medical Genetics guidelines. But the drawback with these guidelines is that they are mostly designed for Caucasian population. They are not for ethnically minority populations like Indians. So they often miss, something which is pathogenic in a Caucasian population, not necessarily will be pathogenic in Indian, and vice versa. So then what we do on top of the ACMG and ClinVar guidelines, we have also functionally and structurally classified each variant. Each of the 7 lakh variants, we have structurally and functionally classified them. And in the clinical report, we tell them whether they are damaging, whether they are probably damaging. And often we have seen that in case of chronic diseases, there might not be a pathogenic variant, a rare variant present, but there are all, a set of damaging and possibly damaging variants. And this is the combined effect of these variants that lead to, symptoms of a disease or appearance of the phenotype. And this is very important. And this is what makes us different from other genomic companies that are out there. In addition to the main diagnosis that you are asking us to do, we are also helping you give additional findings. So in this report, for example, the person has an elevated risk for celiac disease, for milk hypersensitivity. And we know how these allergies can, perturb the immunity and cause systemic inflammations and lead to other chronic diseases. So I feel that this is also a very important feature of our genetic report. So this report is common for you and your patient, but what we also give additional insights to the doctors is, after identifying that these SNP level changes are there in the genes, we also look at the holistic view for that patient and look at the perturbed genetic network underlining those disease, and tell you where is the point of action, which is the key gene that is regulating all the rest of the phenotypes, and if that gene is actionable or not. So using the recommendations from International Consortium of Pharmacogenetics and the gene-drug interaction studies that are available to the database, we combine both these understanding and give the clinician insights about what is the point of interaction there, point of intervention there, and whether if there is a drug target for a particular gene, at what quantity it should be given. So we can even identify if the patient is a slow metabolizer, fast metabolizer, or a medium metabolizer of a particular drug.
So talking about chronic diseases, Saher, can the insights from this report be used to say choose a particular drug that can be given to this particular patient, say a hypertensive or a diabetic?
Exactly, Ishani. So that is the beauty of it. So far, this has been extensively used in cancer diagnostic, because we know that often people become immune to cancer drugs in a year or two time, and then that's what they need, the genetics. So they go back to the genes and identify the targets where they are perturbed, rather than putting them or giving them generic drug that is designed for a particular disease. And now we have expanded this power to other chronic diseases as well, most common chronic diseases as well.
Okay.
So here I just, in this case study, I like this case study because it's not of common diseases like diabetes or hypertension, but of a young man. It's a curious case of a young man who was not born with epilepsy or anything, but in his mid-20s, he suddenly developed seizures, and that were triggered mostly post-meals, And after several years of going to doctors and rounds of doctors, he was put to an initial diagnosis of generalized idiopathic epilepsy. So when he came to our practicing clinician, he was also quite amused at what is causing this and why most of the drug interventions are not working in his case. So then she referred it to us, and he came to us predominantly with the complaints of seizures, sudden palpitation, IBD-like symptoms, and all that. So we did a detailed deep phenotyping and genetic testing on it. So some of the findings from the detailed phenotyping, usual clinical symptoms were all normal. There was no abnormal finding in the MRI, no elevated BP, normal body weight and all that. So, we tend to think that people who are obese are more prone to epilepsy and things like that. But that wasn't true in his case. He just had mild dyslipidemia, some vitamin D deficiency, very abnormal bowel movements, like 5 to 6 times per day. And he also told us that, his first seizure was after a heavy paneer meal. He was a Punjabi boy and he loved his, Punjabi meals and stuff. So that was curious for us. And when we went on to look at the case from epilepsy point of view, we looked at several types of epilepsy. So all the possible types of epilepsy under the sky were screened for him. But we could not find any particular pathogenic variant for this particular guy. So we were quite amused. There were several rare mutations or damaging mutations, but no pathogenic mutations were there. But what came to surprise to us is that he had two very particular metabolic conditions, one known as anemia, and then there is acetyl glutamate synthase deficiency. And both, we know that both of these metabolic conditions lead to abnormal processing of proteins in our body, and also how we excrete ammonia. So one of the clinical tests that can be done to confirm this is to look at, levels of ammonia in the blood and urine and all that. So after this, and we also found that he had celiac disease and milk hypersensitivity as that. And after giving these insights to the clinician, both these diseases are curable, So the clinician was able to, classify him as a metabolic disorder, which is triggering his seizures, rather than putting him in a box of epilepsy and giving him drugs targeted for those. And within 3 months of time, he had 100% reduction in his epilepsy episodes. He had regular bowel movements, and he's leading a much healthier life. So this is one of the, the star cases that we often like to cite when it comes to precision diagnosis, so to say. And then after this, I just want to reiterate that signing up to the precision health programs is really easy. All you have to do is just go on your Android or phone device, download the app, and there you can just make a recommendation. Whichever patient you want to sign up, you can just make a recommendation there and then we take on board all the things. And once the report is ready, we give you the report in the app itself, and all with additional insights about the pharmacogenetics, the gene network, is all available on tap of your hand within your app. And you can track your patients and record. But on the back end of everything, even after giving you the report, we also track the progress of your patient and tell you what happens to him in 3 months' time, say 6 months' time. And if, because I'll show you in the following slide that within the consumer app, we have features which can monitor their adherence to medications, which can monitor their adherence to dietary recommendations and things like that. So wellOwise RX is the name of our app, and it's one of the first genetic resources available globally, really. And there isn't anything out there like this. We have a collection of 12,000 diseases and their subtypes. All you have to do is know the type of the disease, click in there in the button, and understand the underlying molecular pathways or gene networks, and see what coverage you get on various test types that are available within wellOwise. There and then you can order or recommend it to your patient.
Saher, where is the service available? Is it confined to a particular city, or can I order it everywhere in the country?
So it's on a tap of your hand, Ishani. Really, it's pan-India. It's available really anywhere, and we can collect through our collaborators. We can collect samples really anywhere in India. So, so all this talk is good, and as a small startup, we always look for, what peers are doing, what other similar work is being initiatives are being done. And I would like to add here that this precision health approach is not new. It's been going on, and it has been seen for a while. It's just that the adaptation is not as easy as it seems. So more recently, Stanford Medicine has started a program, an initiative which is known as HumanWide. CDC has been working on it since President Obama's time, and UCLA is also running a precision health program. And I feel like this is high time that India also gets ready and prepares itself for a precision health program. And I feel like wellOwise is giving that small little contribution from a startup point of view to initiate that precision health initiative in India. So as I mentioned, in addition to this precision health program, we also run a similar program or a prediction and prevention programs for asymptomatic individuals or individuals which are healthy. And here I just want to give you a snapshot of what all we capture there. And it can be really useful for families of people who have diseases, because we know often these diseases run in family, and even if they don't run in family, they tend to follow same lifestyle. Living in the same household, you tend to eat the same type of thing, do same type of things. So a lot of diseases do run in family, either influenced by your genes or your lifestyle. So what this program does is we look at 200 disease and other traits across nutrition, wellness, fitness, and health. And as illustrated here, the health one is the most exhaustive. Currently, we look at 100 parameters across health, bone health, cardiovascular health, eye health, kidney health, and it's on demand. So if a clinician wants to do stratify the patient rather than doing the precision health program, they also want to do a stratification for a relative to see what their risk is. This is a tool that can be used. And we can add any disease on demand as well. For the nutritionist out there in the looking at the presentation, I would like to say it can be a really helpful tool to really give a personalized diet plan for your clients. We do look at the food responses, particularly fat responses, carbohydrate metabolism, protein metabolism, which we know can be a key, altered metabolism can be a key role to play in chronic diseases onset. So all this preventative health program, or from the consumer point of view or the patient point of view, we have a one unified app which gives you the recommendation, gives you the report. You can talk to your health advisor, you can talk to your doctor, all through this one app. And this is called wellOwise app, and it's available on Android and Apple phones. And then just to end that, I want to say that at the moment, a lot of the work we do is done through our health coaches and nutritionists. But what we feel like to make this precision health approach accessible for wider audience, we would like to create a precision health metadatabase, which will combine the understanding from the literature, the food supplements, and the Indian, there's not much information about the Indian menus and recipes. So that sort of information can be captured. And then at some point in time, we can, under the inspection of a health coach, we can optimize the precision nutrition as well for for specific diseases, or to just personalize health interventions, so to say. And in the end, it's all this is fine. We also constantly want to monitor that okay, we are doing all this is very good, but is it actually giving better health outcomes? So since the start of our clinical and consumer programs, we have been recording a cohort of people who have metabolic syndromes and their parameters over the course of 3 months of the programs. And we have found significant reduction in both, all triglyceride levels, HbA1c level, and there has been a significant weight loss as well. And so to say in terms that we can actually, using our program and personalized, identify those causalities and give you simple dietary and lifestyle changes that can help you achieve better health outcomes. And in the end, I just want to say that at wellOwise, what we see is we want a fundamental shift in this approach to health. We want to make our approach to health more proactive and more personalized. But we know that we cannot do it without the help of our health practitioners, because they are the frontline workers who are in constant touch with the people who are sick, or who are the first point of contact for anybody other than Google, really. So I think that's why at wellOwise we are designing tools to help clinicians deliver better health outcomes and understand the disease better and give more personalized treatment options. And I just want to say that this was one of the first presentation in a series of webinars that we are starting on precision health. The next one will focus, today I was more talking about the concept of precision health. Next will be Elika's presentation on the science and bioinformatic tool, or the analytical tools that we have created for clinicians and healthcare practitioners. And following that, we will have specific sessions on cardiology, nephrology, endocrinology, to give you a flavor of how you can bring it into your practice. And thank you all for coming to this presentation today, and I really appreciate your time and effort. Thank you.
Thank you, Saher. That was a really interesting insight into precision health as a concept itself.
Thank you, Ishani.
Saher, let's take up a few questions that our participants have.
Okay.
So the first one is, current lifestyles affects the gene, and the question is whether this altered or affected gene will be carried out to the offspring, to the progeny.
So Ishani, can you repeat the question? So you're saying the affected genes will be, yes. So this is where epigenetic, as I understand, they are asking if these altered changes will be carried out to the offsprings.
The changes that happen in the gene through lifestyle, can that be passed on to the next generation as well?
Yes, they can be. And there are very illustrated examples in research how a mother's diet for a child's health. And that is the most illustrated way of showing that the epigenetic inheritance, mother's diet, can change a child's risk for developing chronic diseases or not. And simple diet, mother being, having a low carb diet, or mother being underweight, and the gestation age of a child can have long-term evolutionary effects, and risk for chronic diseases can be altered.
Okay.
Oh, so, let me jump in. Sorry, Ishani. I just wanted to add to Saher's answer there. Yeah, so, Saher's point was about mothers and pregnant mothers and lactating mothers, probably. But even apart from that, there is evidence that, what you do during your lifestyle can have some permanent marks on your genes. So your progeny will acquire some of that as well. So, for example, I think they did a study during the Irish famine, like how did that affect the people going forward? So it wasn't just the people who were part of the famine, but their kids and their grandkids.
Okay.
So they found that, so it can persist, yes.
Yeah.
So this only reiterates the need to identify the risk factors for lifestyle that we are inculcating into us in order to stop it from passing on to the next generation as well.
Exactly, Shani. And another example is like smoking. We know that how smoking can be a cause or risk factor for a lot of cancers and chronic diseases. And this is the changes that tobacco or smoking does at an oxidative stress level, and the changes it can, introduced in your DNA that can lead to expression of diseases that, you have inherited, or let you acquire changes that you can pass to your progeny.
All right. Great. Thank you. I hope that answers your question, Anusha. Moving on to the next question. Can lifestyle modification change the gene influence of a disease for good?
Yes. So this is where the whole nutritional epigenetics come into play, that how a personalized diet that is guided by your genes can alter or offset the response towards disease or health. So this is where the power of diet comes into being, and a very little research has been done. But what we know from what research has been published is that a diet and your lifestyle plays a huge role, and yes, it can alter your risk for health for good.
Okay, that's great to know. Taking the next question. How can one change the medication once we know that the disease is hereditary in nature? That is, how would it vary if diabetes is lifestyle driven or genetic?
So, as I feel that there are two questions here. So, first is to understand whether the diabetes that the person has is predominantly because of lifestyle or because of the genes. So, but often in case of diabetes and other chronic diseases, there isn't really a clear-cut answer. It is a mix of both. So what we can do with our tools is, if there is a genetic predisposition, we can tell you and help identify the subtypes of type 2 diabetes or even type 1 diabetes, what kind it is, which genes are perturbed either by your lifestyle or by your genes, so to say, by your family risk. And whether what underlying medications, medications can be given. So not everybody with diabetes should be prescribed, metformin. And why is metformin working for one patient and not for others? And that's where the role or our program comes into play.
True. Saher, the next question is, how would you cater for a disease where heritability is not very clear?
Okay, where heritability, whether there is heritability clear or not, we often don't know what if the person has a family history of a disease or not. And in cases of diseases where we don't know whether they are heritable or not, we just have to look. We need to know what are the underlying gene or gene networks that regulate that disease. As long as we know that there are certain, if there is a molecular phenotype in a disease, there has to be some genes responsible for causing that phenotype. So as long as we know that, we can classify and tell you whether there is a genetic change or there is a SNP level change for that particular disease. Say. I don't know whether it answered the question or not.
Yeah, and if how does it vary from chronic diseases? Say there's a disease which is a chronic disease and another disease that we had, like you mentioned, epilepsy. How maybe the question being asked over here is, what is the difference when we're talking about chronic diseases and say another condition that is not probably a heritable condition, like a chronic disease?
So I think what they are trying to is that there is a difference between how rare diseases are inherited and how chronic diseases. So if I understand the question correctly, the rare diseases are mostly the causality of rare diseases would be regulated by a change in a single gene. Whereas in complex diseases, the causality is regulated by multiple genes. And often in chronic diseases, we see that there is not a single gene that is changed, but multiple genes have changed or are not functioning properly. That is perturbing the pathway that is causing the chronic disease to happen in the first place. So unlike rare diseases where it is a very clear cut, chronic diseases, you have to look at in a more holistic manner, in a more polygenic, look at various changes at various gene levels and not just identify that this one particular gene change will lead to a disease. So that holistic approach has to be there in terms of chronic diseases evaluation.
I think that answers the question. Yeah. Is there any more questions that our participants would like to bring up? We have only as many questions, Saher, but Saher, you can just put up your contact, and in case anybody has any further questions, we can be contacted directly as well.
Thank you all, and I think you can contact me directly on saher@wellowise.com or info@wellowise.com as well. And I look towards hearing from you all. Thank you for your presence today. Thank you.
Thank you, everybody. Thank you, Saher.
Thank you, Ishani, for hosting the session.
Wonderful. Thank you. Bye-bye, everybody. Have a good evening ahead.
And you.